Thank you so much for joining us for this edition of All Angles. Very special program for you tonight. As I'm sure you know by now, it's been exactly a year since Jamaica announced its first confirmed case of COVID-19, and it's also the day that Jamaica begins its vaccination program. So we're going to be talking in the course of the program to a number of healthcare workers and find out how they've been managing over the past year, especially in the past 2 to 3 months with the surge of cases that we've heard has overwhelmed our hospitals. First, though, in this segment of the program, we are going to be talking to the first 2 recipients of Jamaica's COVID-19 vaccination program, Nurse Marcia Thomas Yetman, as well as Professor Denise Eldemaya Shearer. Before that, though, Kelisha Williams was there.
Public health nurse Marcia Thomas Yetman in a cheerful mood after receiving the COVID-19 vaccine at the Good Samaritan Inn in Kingston on Wednesday morning. Mrs. Thomas Yetman went down in the history books as the first Jamaican to receive the jab. Soon after, it was Professor of Public Health and Aging at the University of the West Indies, Denise Eldemaya Shearer's turn.
Thank you very much.
You're welcome.
Former Prime Ministers P.J. Patterson and Bruce Golding were also vaccinated at the center.
Being able to do so on the first day that the vaccine program has started, we are intending to show to the nation that there is no reason whatsoever why people should not accept the vaccine when it is available.
Don't pay any attention to the propaganda, the conspiracy nonsense that Bill Gates trying to kill our black people and all this rubbish.
For the most part, it was smooth sailing. One by one, persons moved from the screening area to the registration desk, the inoculation room, and finally here, where they were monitored for 15 minutes.
I am extremely proud to be vaccinated this morning.
I'm a little bit afraid of needles, as I said, but my nurse was so good, she calmed me down easily, and I'm feeling good.
Carmelita Pessoa McGregor is a dental nurse. Her only issue is that she will be receiving 2 doses of the vaccine. Her second dose will be on May 12.
We had gotten the 1 dose. You know, I guess a lot of persons would do.
Why is that?
So, you know, at least, you know, you're totally, you have gotten it and you don't have to go back. You don't forget the date, you have to try and remember now that you have another appointment, you don't forget it, and then you keep your up, and that's it.
But not everyone was as calm as the people we saw at the Good Samaritan Inn. Over in St. Elizabeth, anxiety.
Deep breath out, deep breath in. All right, sir, press this. Okay. You done? Hold on, sir. Erica will finish right now. Deep breath in, deep breath out.
No, Erica good at this now. Erica very good at this. Let me tell you, I never normally feel it. And this is just one of the circumstances.
Yeah.
The vaccines come exactly 1 year after Jamaica recorded its first case of COVID-19. Now, after a year of hardship, there is finally hope.
We expect just over 3,000 vaccines to be administered. When I leave here, I'm going to KPH, the International Chess, work my way over into St. Thomas, Princess Margaret, but all across Jamaica, primarily in our healthcare facilities, vaccines are being administered. So it is a historic day, and it represents a major shift in the approach now that vaccines are available. And we believe could signal the beginning of the end.
Kelisha Williams for All Angles.
Thank you so very much, Kalisha. And boy, we just have to echo what the minister says there. We all hope that, in fact, this is the beginning of the end. All right, so you can WhatsApp me throughout the program. As always, you can tweet us. Our hashtag is TVJ All Angles, but you can WhatsApp me your comment as well. Our number is 3810072. 3810072. Just give me your first name and your message, please, and your general location. Just have an idea where you are, all right? So in this segment of the program now, as I said, we have with us Nurse Marcia Thomas Yetman, public health nurse, and the first Jamaican vaccinated under Jamaica's COVID-19 vaccination program, as well as Professor Denise Eldemaya Shearer, Professor of Public Health and Aging at the University of the West Indies. Thank you both so much for talking to us here on All Angles. So glad to have you.
Thank you.
So, Nurse, let me ask you first. So how did you come to be first in line for the juke or the jab or the vaccination or whatever it is we're calling it? Was that buck up or was it by design?
We have to lead by example in the healthcare system. And so we're all going to get it as frontline workers, and based on the tiered approach to vaccinating the population, the Ministry of Health and Wellness has dedicated itself to ensuring coverage for all healthcare workers, and I happen to be one of them.
Great. So how did you come to be the first, though? Was it buck up or was it by design? Did they say to you, nurse, do you want to be the first person vaccinated under the national program?
I'm sorry, could you repeat, please? I wasn't hearing you just now.
That's okay. I'm asking if they had come to you, if the ministry said to you, do you want to be the first person vaccinated? Was it planned?
We wanted to have healthcare workers representing. We find that we have a challenge with persons, particularly with healthcare workers. And since we are at highest risk, a number of persons are watching. And some of my colleagues will say, well, I want to see who get it first, and we want to make sure that them are right and make sure that nobody don't drop down. And I'm happy to say at this time, how many hours has it been? It was 8:15 that I got my vaccine. 12 hours would have passed and I am fine. And so we had to ensure that healthcare workers who are frontline persons are in the mix, and that we would have to lead the way for the rest of the population.
Very important.
Yeah,
but here, nurse, hold on. Hear what I'm asking you. What? How did it come to be that you, Nurse Yetman, had been the first person vaccinated? Is it that you just turned up and happened to be the first, or did you know you were going to be the first?
They wanted to be healthcare workers to be there, and I was asked to come, and I was the first person to be vaccinated.
So you knew you were going to be
early.
You knew you were going to be the first person then?
I wanted to be the first person, wouldn't you?
Well, that's what I've been asking. Because of course, with that comes a lot of scrutiny, lots of interviews and so on. So how has the day been? Because I know there's been a lot of focus on you.
My day was pretty much a regular day. Visiting the site would have been part of my responsibility as a regional nursing supervisor for Sarah. So having been vaccinated, I went on with my usual duties, visiting the various sites within my region, and to ensure that everything was going as planned and that persons are doing what they're supposed to be doing in terms of the vaccination. And so that's what I did after I received my vaccine.
All right, let me bring in Professor Eldemaya Shearer here because, of course, another very high-profile individual who received the vaccine today. And Professor, for you, was there any hesitation at all?
Absolutely none. When I was called, clearly because of my other role as patron National Council for Senior Citizens, and asked if I was willing, and I said, certainly, what time? I think this vaccine is extremely important for the country, and particularly for our seniors, that if they do get the illness are at greater risk of severe illness. So I think it was important to do it.
When we last spoke on this issue, maybe a couple of months ago, at the time you had said you were still evaluating the data and the research up to that point to see what would be the advice for seniors. So tell me what is showing now.
We're seeing the problems, as I had mentioned then, Dion, of the loneliness, of the social isolation and the difficulties of staying at home. As you mentioned, it's now 1 year. So this vaccine comes as a blessing and a relief for most of our seniors because it is the start. We know there has to be the second, and we know there has to be a prescribed set of weeks after before you can come out as you would want to. But it's almost the start of freedom.
And as you mentioned, your position there in terms of the community of representing older people is important, because that has been the question a lot of people have been asking. Is it indeed safe for the elderly? When you look at the research, tell me what you're seeing.
When we're looking at the research, it's extremely safe. We're seeing it for the different vaccines. There are 3 or 4. We have AstraZeneca at the moment. There is Pfizer. I have colleagues in my class and my group from the 1979 class that have had it, that have had no problems. We don't know much about the Johnson & Johnson one yet, but again, it's been passed by the FDA. So we know it's not only safe, but it is effective in older people. And therefore, I would urge all of our seniors, as soon as you have the opportunity, it's very important to actually come and get the vaccine.
Does that apply to all age groups? Because of course we know the ministry has said they're prioritizing those who are 60 and over. What about if you're over 80, if you're over 90, if you're over 100? Does it matter?
I thought when you said all age groups, you were going to tell me to motivate young people to take it so they don't infect the old people. I thought that's where we were going. Yes, and it's particularly so for the 80s and 90s. Because remember that the death rate, if you get COVID, accelerates with each decade, so that you're seeing it almost like the general population for 60 to 65. But we're seeing a 45% death rate among the 80 and 90-year-olds. So it's even more critical to do them.
Nurse Yetman.
We can't afford to lose our seniors. They're grandparents to so many people. They are backbones of communities. They are our treasures.
Yes, absolutely. Nurse Thomas Yetman, let me come back to you, because a lot of people are startled to hear the NAJ, Nurses Association of Jamaica president, say earlier this week that in fact we've lost 3 nurses to COVID-19. For you, therefore, the start of this vaccination program must be especially poignant.
Very, very special. And we find that as the number of cases increase island-wide, healthcare workers are affected. We are part of the population, and whatever affects the general population is going to affect the healthcare workers. And so this really is important to me that we have the vaccines now, because it means that we can protect the healthcare workers so that they are ready and fit and able to look after all the patients, not just those with COVID, but because persons are getting sick with other illnesses. All the illnesses that were in existence before COVID-19 came are still on. And so those persons still need to be cared for in addition. And so I'm happy that we now have the vaccine. We can protect healthcare workers and other members of the public as well. So it's a very, very, very good thing for us.
Gonna leave it there. Can I thank you both so very much for talking to us? Very much appreciate your sharing with us, and certainly bring on the second dose and for the rest of the population. Thank you. Let's go to break. When we come back, we're gonna, for the next few segments of the program, we're gonna be talking to healthcare workers, other healthcare workers, hearing their experiences over the past year. Stay with us. Remember as well, you can WhatsApp me, 3810072, 3810072. Don't call, nobody not going to answer the phone, just WhatsApp us. And as well, tweet us using the hashtag TVJ All Angles. Welcome.
Jamaica today confirmed its first imported case of coronavirus disease 2019, COVID-2019, here in Kingston. The patient is a Jamaican female who had traveled from the United Kingdom, which, as you know, has cases of COVID-19.